Hi, I'm Dr. Jafari from the Jafari Acupuncture Clinic. I wanted to answer a few questions about our stroke treatment process. Mainly, I want to talk about who it's good for, how it can help, what it is exactly that we do in our treatments, and lastly, when is the best time to do it. So let's start with the first thing, who is this good for? This is pretty much works for any type of stroke, whether it's ischemic, hemorrhagic, or even a mini stroke. It can apply to all of these situations. The second thing is how can it help? The underlying principle behind all of this is to help you have a better life. We want you to become independent, we want you to regain movement, and we want you to have a life that feels more normal. Obviously, normal can be very different depending on the severity of the stroke, but the closer we can get you to that reality, the better. So, in terms of specifics, what it is that we work on, the things that we can help with are paralysis, hemiplegia, like if you cannot move the arm or the leg or the hands and the feet. We can help get movement going again in the limbs so that you can eat, feed yourself, wash yourself, walk again, things like that. A lot of times there's a lot of spasticity, stiffness, tightness, spasms in the muscles. We can also help with that. Another main thing that's affected is the tongue. A lot of people have, after a stroke, trouble speaking or swallowing or eating on their own. So this type of treatment can actually help with tongue movement so that you can do those things better. Other things is depending on which part of the brain was affected, you might have lack of balance, you may have a lot of headaches, a lot of fatigue, just those kind of general things. This treatment can also help with that. Now, in terms of the more science of how it helps, basically after you have a stroke, especially ischemic or hemorrhagic, a part of the brain tissue is damaged, it dies. Now, that is irreversible, it cannot change. But what can change is the area surrounding that damaged area. So your body has this pretty incredible protective mechanism where when there's a stroke and a part of the tissue dies, it also shuts down the area around the damaged area. Okay, so the fire's here, but it will shut down some of the area around it as well to protect the whole brain. It's kind of like let's say you have a building, a 10-story building, and on the 10th floor, in one of the rooms, there's a fire. And the building's protective mechanism basically is to shut down the entire 10th floor, even though the fire is in just one of the floors. Your body does the same thing. It shuts down an entire floor, even though the rest of that floor is not damaged. So what we can do in these situations is we can help wake up that area of the brain that's shut down, that's basically asleep. Research has shown that if you rapidly increase circulation to those shut down areas right after a stroke, you can actually help wake up that brain tissue. When you wake that tissue up again, you're going to get a big change in terms of your functioning, in terms of movement, speech, all different types of things can improve and get better if we can wake up that area that's turned off. So specifically, how do we do that in our treatment is a very special type of acupuncture, stroke acupuncture. It's very different from the regular acupuncture you might receive. This type of acupuncture originates in a city of China where that entire city is basically the stroke capital of Asia. They specialize in integrative treatments for stroke, and one of the key components is this specific type of stroke acupuncture that they use. So it's been well researched, it's clinically proven to be effective, and that's exactly why we use it here. We want to offer you the best that we know of. Now, in terms of when is a good time to get this type of treatment, the first 90 days after a stroke are the most important. If you can receive this type of treatment during those first 3 months, it is most effective. Now, if 3 months have passed and you're wondering, well, can this still help? Yes, it can, but the amount of effect it has is just not the same. It can still change things, but the best time to do it is in the very beginning. Anytime there's a stroke, we want to approach it very vigorously and frequently, which is why we have patients coming in often 3-4 times a week those first few weeks after a stroke, because that's what gives us the best chance to get that brain tissue to wake up and to recover function. So if this is something that you think would be good for you or for a loved one that's been affected by a stroke, the next step would be to set up a free consultation at our clinic. It's in person here at our clinic with myself. It's about 20 minutes. It gives me a chance to talk with you, hear what's going on so far, and just to make sure that this type of treatment is a good fit for you. So if that's something that you would like to do, after you close the video, you can click on the free consultation button below and we can get started. Thank you.